Well, hello and welcome to BW Healthcare World. Today is International Day of Action for Women's Health, and we are here to talk about common issues that women deal with related to their health in India. It's the health-related issues wide prevalence in India, and we'll be pondering upon the possible solutions for these problems that women in India face with related to their health. Some of the reports suggest that women are responsible for 70 to 80% of all healthcare that is provided in India. International reports suggest that gender parity in health and survival is at 146th place. India stands at 146th place in terms of health and survival in gender parity. We already know that incidence of breast cancer in India is rising. We know that there are reproductive health issues that women are beginning to that's at an all-time high, and we have disorders like PCOD, postpartum depression, and whatnot. The list is endless. So, to talk about on some of the solutions or some of these big problems that health-related problems that women face in India, we have one of the renowned names of gynecology and obstetrician. We have with us Dr. Sonia Malik, who is the Director and HOD, NOVA Southend Fertility and IVF. Thank you for joining us here, ma'am. Pleasure to have you here.
Thank you so much. Thank you so much, Shivam, and thank you, Business World, for giving me this opportunity on this very important day as far as women are concerned.
Yeah. Ma'am, women health is a topic that is talked about a lot, and we've been talking about, improving women health. The government is talking it, but currently, on the day we stand, how do you see the health of modern day women in the current scenario? What are the things that are of concern when you look at their health?
When we talk of women's health, yes, we are talking of the modern woman, but the modern woman doesn't translate into only the urban woman. We will have to talk about the huge segment of rural women as well who are there in our country. And, there is a lot of disparity in the problems that the urban women face vis-a-vis the rural women. Although, by and large, yeah, you mentioned gender disparity. You mentioned that there was a problem like that. And if we do stand at 146 as far as the world is concerned. But as far as our health problems are concerned, be it the urban woman and be it the rural women, gender disparity is one of the major problems that I think there is in the country. Let me just elaborate upon that. We are still struggling with female feticide. The country is still not overcome it, although to a large extent we have decreased it by very harsh measures like the PCPNDT Act. But still we find that there is a disparity between the number of boys as compared to the women being born. That is the first part. And then as the child grows up, there is a gender disparity as far as nutrition is concerned. And see, there is always an edge. The mother, I don't blame the men for that. I blame the women themselves for that, because it is the mother and the grandmother who is differentiating between the boy child and the girl child. And, the amount of milk, for instance, given in the rural segment or the urban segment is much less to the woman, to the girl child as compared to the boy. So, undernourishment starts from there, right? And then that woman who grows up undernourished is having malnutrition and anemia, deficiency diseases. So that is something that the country is facing majorly. We have communicable diseases, but now the country is absolutely bogged down by the non-communicable disease. And topping the list is anemia. Every person, I think, is anemic in the country. Every person is vitamin D deficient in the country. So, I'm talking of women largely. And these two factors are really responsible for reproductive health as well. An anemic mother is not going to give back birth to a good nourished child. It is going to be an undernourished child again with all kinds of deficiency diseases, be it vitamin C, vitamin D, whatever. You know that these are all responsible for the formation of various organs. So that is why it all stems to the gender. And then let's look at the grown-up girl or the grown-up woman who gets married. In her household, be it a girl in the city or in the rural belt, she will not give much attention to her illness or to her problems, and she will hide it most of the time because maybe she's not going to get that much of attention as is required to go to a hospital. Hospital services are not as easily available to the rural women as they are to the rural men. That is also a disparity. So eventually, the whole life of a person, and finally, when she is old age, and then that the number of home deliveries, of course, the government has been very strict about it, and with these various programs that the government has launched, Matri Suraksha Yojana and the Child Suraksha Yojana as well. And the emphasis on hospital deliveries, they have decreased, but yet there is a huge segment of people who still prefer not to go to hospitals and deliver at home. So during the reproductive health, again, that maternal mortality is not reached the stage we want it to. It's still high. And so also infant mortality. And then finally, you go on to old age. What happens over there? The woman outlives her husband. The woman outlives the men by about 5 years or 3 years. And so they are essentially not, there is nobody to care for them once that happens. Most of them live secluded lives. And hence, like you said, mental health has become a huge issue as far as women are concerned, right from adolescent to old age, because of the various problems that we are having as women. In the adolescent age, you mentioned PCOD. Self-image is a big problem because PCO girls they are obese, they have problems with their face, etc. They are not, they have lots of acne, etc. So they have that self-image problem, and hence depression and anxiety. You mentioned postpartum hemorrhage in the reproductive age group after the woman delivers, and then in the old age again because of loneliness, because of being alone. Again, the same thing. So suicide rate in the country is much more as compared to other countries. So these are some of the non-talked about problems that we have in the country. And then I think you should ask me the next question. I think I've spoken a lot about the kind of problems that arise only from gender disparity. Only from gender disparity.
Right. And it starts,
Right?
in the
Yeah,
childhood itself, and then it
absolutely.
ends,
Before
in
even
the,
the child is born,
yeah,
it goes on and on. Yeah, yeah.
right. So, are there any common signs that these women show or they neglect, in terms of their health, or are there any signs that which keep coming up, but they're just not paying a heed to it?
See, the biggest one of the biggest killers of women in the country is tuberculosis. Tuberculosis with HIV, not alone as well as with HIV. Now, here are the symptoms: respiratory symptoms, which if they will have cough, they won't bother about it. They will have, a little bit of colored sputum, they won't bother about it. Ho gaya, chalo, koi baat nahi. Asthmatic cough. So these are the initial symptoms. Or a woman will have a little bit of pain in her chest and she's not worried about it. They generally reach the hospital in a stage where it is too difficult to treat them. At late stages, whether it is an infectious disease like tuberculosis, or it is a heart disease, or it is a heart attack, even in the if you look at the data, you will find that the severity of heart attack with which the women report to the hospital is much more as compared to the men. There is a lot of awareness about heart disease now in the country. Cardiovascular health is at its top now, but still we find that women are neglecting this. So these are some of those diseases which we are all right. I mean, it's all right. It happens to men as well as women. But if you talk about particularly women's diseases, you were talking about cancer breast. They will have a lump in the chest, but they won't bother. They say, no, ho gaya, chalo, gaant hai. Shayad thoda hoga. They will treat it by putting some herbs on it or putting something. Even the urban woman will not go for a mammogram. She will not let herself get examined. She will say, oh, chota sa theek ho jayega. Majority of us are like that. We will neglect it, and nobody wants to go for a yearly check. Just as men go for yearly checks, women are not yet getting used to going for yearly checks. So breast cancer, also cervical cancer. Cervical cancer used to be first, but now breast cancer has become first. And cervical cancer also, because basically with multiparity coming down, we are very, very stringent about having a two-child norm. But then the multiple partners don't decrease, and HPV virus is very much rampant in the country as well. And that needs to be put across. That awareness has to go. They will have a discharge, but they won't bother about it. They will have some kind of an abnormal bleeding, but they won't bother about it. So these are some of the things that they will not tell you about, and they will not come forth.
The reflex, I mean, neglect is the reflex
Yes,
that the women
yes,
have
yes.
when it comes to health issues that needs to be, kind of
Corrected. You see, they are
corrected.
themselves responsible. Majority, like I said in the beginning, it's the women who are responsible for their own, I would say, adverse problems. Because if a senior member in the family is going to behave like this and not allow the juniors also to go forth and change, it's very difficult. Once in a while, there is a girl who defies them and comes forth and makes a change, but that number is very small. Of course, things are changing in the metros, in the bigger cities. We have women who are taking their own decisions and doing things which are required. I don't say that because I'm practicing in a city. I'm in Delhi, so I practice in a city where I see that a lot of change happening. But still, I feel that there is a lot that needs to be done.
Right. When we talk about particularly about working women in the workforce right now, and how do you think stress is contributing to their health problems in particular? And when we talk about working women in the workforce, and they most of them come home and work at the home as well. So, are there any other factors also that affect the women health apart from stress? But let's please start with stress.
Stress. Yes, we are talking about the urban woman now. You're
Yeah,
talking about the
yeah,
urban. Well,
working
yes,
women.
90% of urban women are working. Working. They are not housewives anymore because of the economic problems that we have. So basically, what happens is that the stress is not just work related. It is also related to the number of hours that they have to spend in the offices or in their workplace. Basically, I think the schools are the only place where the works is much less in relation to the hours that they spend at school. But when they come home, they carry all that homework home also, because they are expected to keep on sort of looking after the students' work even when they bring it back. So all that adds a lot to the stress that is there. And many of us, or many of these women, are doing night shifts. They are not there during the day. So that is also changing their circadian rhythm, and which is also responsible for so much of reproductive health problems, not only in the women, but also in the men. I won't say that it's not happening to the men. It is happening. And I being a person who's practicing IVF and infertility, I find that our ovarian reserve is going down very badly. Our girls are now not able to reproduce at young ages like 29 and 28. Even over there, they are finding problems in reproduction, and they come forth for assisted reproduction. Why is that happening? There is so much of stress both in their work life as well as in their home life. They come home tired, and then they have to fend for their home thing, all the looking after the household. If they don't have children, that's another stress. But if they have children, that is adding to their amount of work that they have to do. So essentially, yes, stresses are of many kinds, and all that is adding up in a life of a woman. She has to be like a Durga Mata with many hands, and so she has to function like that. That is why this happens. Although yes, now men are changing in the urban cities. I find that boys and men are helping their wives to do all these things once they come home, because they realize that both of them are working equally hard. Yes, that is one stress, the work stress. The other stress is we do not know what kind of a work environment there is in the area that she's working in. Suppose she has a very hospitable and a good friendly environment, then the stress is halved. However, if there is some kind of a work related violence, or there is a problem, there is a sexual assault over there which has happened, which she cannot share with anybody. So those kinds of stresses are also there, and we know that this is happening in many of the workplaces. that makes it very difficult for women to function in places where the environment is very hostile to them. So these are some of the things that they live with, and they do not know how to tell people about it, because obviously nobody is going to understand that this has happened. So that is what is. Then,
Like
sorry, yes.
what are the other factors that doctors are now talking about when we talk about women health? Is the lifestyle that they are leading, same as men. They are, smoking in big numbers now. Their eating habits are as bad as, anyone like all of us. So, what are those factors? Doctors also highlight that smoking is very much responsible for many of the disorders that women are these days having. Or can you please highlight some of
Absolutely right. Smoking is it is a disaster for women, to smoke, because basically it upsets the reproductive tract like anything. The quality and the number of eggs that she has in her body goes down. And it's not just childbearing. I mean, the child is going to be born with hazard problems, because basically it's going to be a malnourished, undernourished, small for dates kind of a baby, premature, preterm baby. She's not going to be able to give that nourishment which is required in the intrauterine life to a baby when she's smoking. Even I would say passive smoking. If a husband is smoking like an engine, then again it is going to affect the health of the mother and the unborn baby, as well as the child once it is born. So therefore, smoking is really, really hazardous. We all know that. And along with that, professional areas where there is a lot of smoke, these factories, which are giving rise to so many emissions, not only of smoke, of charcoal, but other emissions, where there are giving rise to chemical emissions, which are also hazardous to the environment as well as to the health of men and women alike. So basically, all that is very important. And of course, you are saying that there is a change in the lifestyle. See, unfortunately, what has happened to us in India is that we have acquired all the bad habits from other countries, but probably not some of the good habits that we have seen in the other countries. For instance, punctuality, being honest to our work, sincere. So there are so many qualities. But what we have actually acquired is alcoholism and smoking to a large extent. So these things, of course, sorry, even alcohol, not as much as smoking, but yes, even if she's an alcoholic, or I go a step further, if she's taking drugs, that again is very injurious to her life, and then, of course, the future generations. When we are talking of a maternal health, what are we concerned about? It's not just her problem, it is the problem of the society, and it is a problem of the nation, and finally, it is a problem of the next generation that is going to come up. So basically, we have to think long term. And when we are talking of these radical changes where we are asking women not to smoke, not to drink, not to be alcoholic, not to take drugs, it is because we are not only worried about her, but we are worried about the nation at large, and what is going to happen later on. So yes, and then you know for yourself, if they are not eating properly, or if they are having only junk food, they are going to give rise to hormonal imbalances, which may result in diseases like PCO, where they have become obese, and they have a lot of acne and hair on their faces, and they have a problem then. So hence, women have to be very careful about what they eat, what is their intake of abusive substances. These are all substance abuses, and so they have to. When it is called substance abuse, it should not be taken.
a lot of a lot of women or girls in the young generations are taking heavily onto smoking. And when I mean, they take it upon as an equality. Why? I mean, that is the
If
thing
the
that
man
goes
can.
around. Why can only men have fun in
Mhm.
that sense? So how would you counter that?
Yes, I understand. It is basically, see, I mean, the tradition has been there for a long time. We can't say that it's now that the women have started smoking. We know that women in the villages have been smoking the bidi, and they have been very used to doing having hookah as well. So that kind of a thing has been going on, especially in the north and in the central India. We find that there is a lot of smoking of bidi and hookah and intake of pan. We may not find it in the southern states. I'm not very familiar with what was happening in the past, but yes, I know that in the north it is very prevalent. So that is. I asked one girl. I said, "Why can't you stop smoking? Why you will have to do it? I will not be able to help you otherwise." She says, "What can I do, madam? Everybody in my house smokes. My mother-in-law, my father-in-law, my husband, my devar, my nanad, and I. So how am I alone going to stop it?" So, that is what is happening now. It has become so difficult to tell people, although the government is doing its best in saying, and the ads also contain that it is injurious to health and the cancer risk is high. Yet people don't stop it. But of course, like I said, awareness does make a difference. And people like you who are asking us questions like this, and we answering these and telling people, okay, this is bad for you, don't do it. So I think this will help. Somewhere it is going to make a change. The only thing is we have to take it down to schools, because the colleges are past it. They are already doing what should not be done. But if we are talking of prevention, like you said, what are the measures that we should take? I think we'll have to talk about this to the school children, because I see it as a major impact happening through the schools on the environment, on the cleanliness. The school children are very aware of cleanliness, and they don't dirty the roads at all. They are so much, they are checked at all stages in their school life. So it has made a change. But I think that should be done also for smoking and alcoholism. Children in the schools have to be educated, and so the next generation probably will improve.
Right. You know what? If we can talk about the role of the government here when it comes to, promoting the women's health, where do you think that lies?
Eventually, it has to be the government who makes programs which are successful. Let me give you the example of the Sauchalaya. The Prime Minister was so rigid and determined to have Sauchalayas for women and for everybody, so that, and start a cleanliness drive in the country. It has made a change, definitely has made a change. And with that, menstrual hygiene has also come into the forefront. You now have programs and people are talking about menstrual hygiene and sanitation. So it has, it is always the government that drives it eventually. If they notice something and they say you have to do it, then everybody listens. So and this, because basically then it becomes a program for the whole country, and hence the country starts to change. I think the government has a huge role to play in this, and I do congratulate this government, because they've come up with so many schemes for the women, that it should make a change to the health of the women in this country.
Right. Uh, and recently there have been developments relating to vaccinations. We have the
Yeah,
cervical vaccination, which is available.
absolutely.
Um, and what how what do you have to say about that in terms of its awareness? How we can create more awareness for these vaccinations, and what women need to know about them?
Yeah. Uh, well, vaccination, again, I will come back to the government. Say about 10 or 15 years ago, the government started promoting tetanus vaccine in pregnancy on the television. There were programs which were telling them that, okay, you are pregnant, have you had your vaccination? And so after that, every woman would come to the doctor. Even if she forgets, they would not forget. So they would come and ask for the vaccination. So I think if the government on a large scale promotes these vaccination programs, they have to keep the revised WHO immunization program in mind and start promoting it, not only for the women but also for the girls, I would say, and also for the boys and men, because it's not just cancer vaccine which is important. It is the other vaccines also that are important. We have the flu vaccine, for instance, which is very important for people aged above 65 years, that they must take it, otherwise they will have very bad respiratory problem, and they might die of it. So things like that. And yes, the cancer vaccine, as you're saying, needs to be promoted at a large scale. But people have to be aware that it has to be taken at a younger age, before age 26. That is the age where it has to be taken from girls who are in their adolescent to 26 years of age. Beyond that, it is not helpful, although we are now getting vaccines which may help at later ages also. But more important than that is like I said, it is because of a viral disease that this cancer is born. And that HPV virus also resides in the male. But we are not bothered about vaccinating the males at the moment because our women are so many. If we are able to vaccinate the women, it will bring down the risk of cancer tremendously. Hence, the program is presently for women, but eventually it will happen for men as well, because the prevention lies in not transmitting the disease from the man to the woman. It's a sexual contact which is giving rise to it. And just as we have HIV, now we have tried to bring it down. Similarly, HPV virus will have to be controlled by vaccinating the men also. So that is a later stage. Presently, yes, women have to be made aware of it. School children have to be made aware of it. Early college going girls have to be made aware of it. The teachers have to be made aware of it. And so, again, if this is a government run program, I'm sure it is going to do very well, because then it will go all across the country. We need to
Right.
do it. Yeah.
Right.
Yeah.
We've spoken about a host of issues when it comes to women's health. We've spoken about nutrient deficiency, where it begins, to the adolescent age, where you have these lifestyle habits which are going bad. Uh, what what do you suggest how this can be curtailed? And also, when we talk about nutrient deficiency, today we have nutraceuticals. We have a whole industry which is selling these medicines which they say is, we have vitamins and all sort of vitamins. What would you suggest? Should the women go the nutraceuticals way, or should they try to take nutrients from what is available in terms of their plate?
See, I'm not trying to take sides with the pharmaceutical companies. I'm not. For a long time, I was also very much against these so-called nutraceuticals, and to take all this thing in my diet. But now what has happened is, we all understand that there is a lot of pollution of food. You know, our to the extent that even our soil has become polluted. There are so many nutrients which are missing in the soil, and then on top of that there have been so many products or so many food items that have been engineered. Bioengineering of plants have taken place. So somewhere all that has destroyed the nutrients of that particular segment as well, and hence the deficiency diseases are on the rise. Why is NCD on the rise? Because we are deficient in so many things in our diet, and we are trying to compensate it by giving extra things. Nutraceuticals are a measured amount of a particular substance that is added to it. For instance, if we are talking of vitamin C, there is some amount of vitamin C to the 500 milligram or whatever added to a particular tablet, and so when you take it, you are sure that you are taking it. Hence, that is why women do have to, for ages, we have been giving women iron and calcium in pregnancy. Why did we give that? Because our diets were deficient in iron, no matter how good we were in about 50 years ago, but we were deficient. And also in calcium, and we found that most of the women were having osteomalacia or deficiency of calcium during pregnancy and later on as well. So we had to resort to supplements. Now again, what has happened is the amount of supplements that we need has increased because the food is more polluted. So I'm not saying that I think that this is a wrong thing to do, but yes, wherever it is, you should get yourself checked. If you're deficient in something, there's no harm in sort of supplementing it with a nutraceutical, because you will need it. Now, the incidence of thyroid disorder has increased in the country. We find that many of our patients, many of our people are deficient in thyroid hormone, and we all have to give them medicine to correct that hypothyroidism, especially in the females, not so in the males, but especially in the females. So why is this happening? Again, because of the deficiency that we have in diet, and also because women are more prone to this disease. So there comes the role of hormone therapy. You have to do it, you have to do it. That is what is happening.
Right. Uh, We've talked about these solutions. How can families take care of women's stress and health issues in the long run, do you think?
We are it's we've come a we are coming this making the circle round. We are coming back to the same point where we started. It's gender equality. When a woman is respected in a family, when a mother, a sister is respected in the family, there will be no problem. She will be getting the same equal status as the other persons in the family, the men in the family, and that is when the health of the woman is not going to suffer. She will have an advantage because she's also a caretaker. The emotional aspect of a woman is very different from that of a man. They are more emotionally labile, they are more sensitive, we know that. And so if she is cared for, if she's looked after, I'm sure she's going to be a much better human being than she would have been if she was not looked after. So taking care of the woman in the family is the first thing that a society has to do. The family has to respect the woman, then the society will respect the woman, and hence the country. So, I mean, we know these sayings saying that God could not be everywhere, so he made woman, So, like that, we know that there is a definite place for a woman in society, and that has to be respected, and that respect has to be brought back in the country.
Right. On this International Day of Action for Women's Health, what action would you prescribe the women who will see this?
Uh, it's a very difficult question to answer because there are all kinds of women who will be seeing this program and listening to this. But I presume that most of them will be educated women. And I would say that it is of course their duty to look after themselves. But if a woman undertakes to look after 5 women around her, then the multiplication will be great. If she has the energy and the bandwidth to take care of 5 women or 6 women around her, maybe her home help, maybe the boy who comes to clean her utensils, maybe the driver's wife, anybody, or the small child, a small her maid's daughter, if she takes care of the health of these 5 6 women around her, then I think there will be the problem in the country will be solved. So it's not just the government, it is us also who have to take care of ourselves. And I think that is the message to all of us, that सब कुछ सरकार पे नहीं छोड़ सकते. We have to look after ourselves. After all, we live in a democracy. The sarkar is also made by us, for us. So therefore, it is us who have to look after ourselves. And if we change, I'm sure the society will change.
Right. Well, on that note, thank you so much, Dr. Malik,
Thank
for
you.
joining us here. It's been a pleasure chatting with you on these issues, and I hope women do get ahead with preventive checkups, which are
Yes,
very important
very,
across
very.
genders, but especially for women. And be aware if you have any micro nutrient deficiency, and take proper supplements because it's all starts there when you start having these deficiency. Thanks again. Thank you so much, Dr. Mali, for joining
Before
us.
I leave,
You want to add something?
yeah, before I leave, just one thing that I would want to talk about is there is a huge longitudinal study which everybody quotes from India. This is in the pediatric field, and it is around Pune that they started it 26 years ago. They have spanned three generations. So when they looked at the grandmothers in that area, it's in some district of Pune, and they found that very few women, they were all fine, thin, slim, everything, and all working in the villages and agriculturists with very little financial help and all. And so the children that were born were thin and underweight and etc. Gradually, as the country became rich, the second generation became a bit better. So the children born were of better weight and much better nourished. Now the third generation, which is coming up, has become more nourished. So the mothers are overnourished. There is a higher incidence of diabetes in them, and hence the children are also having problems. So 26% of the women now in this generation are affected. So it's not just that, अमीर होके ही सब कुछ ठीक होता है, ऐसा नहीं है. They've become rich, but they also have diseases like diabetes coming up, and hence again problems. So I want this message to go across. We talked about alcoholism and smoking, but these diseases are also on the rise because because of bad food habits. And, probably because we are rich now, we have more to eat. So that also has to be kept in
And
mind.
less
And
exercise,
balanced.
obviously.
Yes, balanced,
Less
yes.
exercise, obviously, less
Exercise.
walking and,
No
sitting
walking.
around.
Yes, absolutely. The nature of work has changed, and hence this is happening.
Right,
Thank
right.
you.
Thank you so
Thank
much, Dr. Malik, for joining us here.
Thank you so much. Thank you so much for this very interesting meeting. Thank you so much.